Hi, my name is Megan Brown, and this is my head-to-toe assessment. And I have gathered all my supplies. I've got my stethoscope, my reflex hammer, and my pin light. And I have done my hand hygiene. And I've provided my patient with privacy. I've closed all doors. And I have taken the patient's vital signs. His blood pressure is 128/78. His pulse is 68. His respirations are 18, and his O2 stats are 98 at room air. And I'm going to go ahead and get started. So, hi, my name's Megan. I'm going to do a quick assessment on you. It takes about 15 minutes. Are you comfortable? Is now a good time?
Yep.
Okay, cool. Alright, so can you tell me your name and date of birth?
David Mallory, January 8th, 1984.
Okay, good. Can you tell me where you are and the date?
Mankato Hospital, June 5th, 2016.
Okay. Alright, good. So the patient is alert and orientated ×3. He's got straight posture. It's good. He doesn't have any dandruff or lice in his hair, and he doesn't have any offensive odors. So I'm going to go ahead and I'm going to get started. So first we're going to do close your eyes and let me know where I'm touching on your face.
Nose, chin, forehead, cheek.
Okay, so his sensation of his face is good, which is cranial nerve number 5, and I'm going to have you puff your cheeks out and smile and stick your tongue out. Okay, good. So that is cranial nerve number 7, so the movement is good. And I'm going to have you push against my hand. Okay. And again, okay, good. And shrug your shoulders for me. So that is cranial nerve number 11. And now I'm going to check your ears out. His left ear is clear, external canals, no drainage, no buildup of cerumen. And his right ear is the same, clear canal, no drainage, and no buildup of cerumen. So I'm going to assess your eye real quick. So just look at the wall behind me. Okay. Alright, so his pupils are round and equal and reactive to light accommodation, which that is cranial nerve number 3. And I'm going to have you just follow my pen light. Don't move your head, just your eyes. Okay. So extraocular movement is intact, which is cranial nerves 3, 4, and 6. And I'm going to have you cover your eye. Okay. Can you see my fingers? Here, here. Okay. Can you see my fingers? Good. So cranial nerve number 2 is intact, and you can hear that. Okay, so cranial nerve 8 is intact. Alright, so I'm going to go ahead and I'm going to feel your lymph nodes. So just clear your normal. So submandibles, submandibular, tonsils, anterior cervical, posterior cervical, occipital, post-auricular, peri-auricular, and supraclavicular. No notable nodes found. Okay, so now I'm going to have you hold your arms out for me and resist me pulling and pushing. Okay, and pulling and pushing. Okay, good. And grab my fingers and squeeze really hard. Ow, okay, that's good. Okay, and now I'm going to do the same on your feet. So resist push and pull. Resist push and pull. Good. And while I'm down here, I'll go ahead and look at your feet. Your capillary refills are less than 2 seconds. There's no edema, swelling, tenderness, or redness on the left or the right leg. And on this left foot, capillary refill is less than 2 seconds. No redness, swelling, edema, or tenderness. And on your hands, his capillary refill is less than 2 seconds on both hands, and there's no tenderness, swelling, redness, or edema in either arm. He does have tattoos. And now I'm going to have you stand up for me real quick. Okay. And just stretch your arms out, put it behind your back, good. And down here, and stretch in front of you. And here, good. All right, and rotate your hips for me. And the other one. Okay, good. And stand there with your eyes closed. Good. I'm just going to check your balance. Okay, good. So you can have a seat again. I'm going to have you open your mouth for me. Say, good. Okay, so tongue and uvula is midline, and there's no noted lesions in the mouth. All teeth are present. So that is cranial nerve number 9, 10, and 12. And I'm going to go ahead and I'm going to do your pulses. So your carotids, a good rhythm, palpable, definitely feel them. And +2, and brachial. They are symmetrical rate and rhythm. And radius. Pulses are symmetrical and in rhythm. They're +2. Now I'm going to do your posterior tibial pulses. They are +2 and symmetric. And your dorsalis pedis pulses. And they are symmetrical and rhythm +2. Okay, good. So now I'm going to do your reflexes. So I'm going to take your arm and just relax it for me. Okay, good. So that was your triceps. So now I'm going to do your brachial. Relax, good. Okay, good. And your brachial radial pull or reflex. Okay, good. And over here, triceps. Good. Okay. Brachial. Good. And your brachial radius. Okay. And now I'm going to do your patellar. And patellar. And your Achilles clonus. Achilles clonus. Okay, and yep, okay. All right. So now I'm gonna just put this into you, and you'll just breathe normal. Go ahead and cough for me. Okay, good. So there's no accessory muscles used. His depth and rate are symmetrical. I don't see any deformities of the thoracic area. And his AP bilateral is 2-to-1. Go ahead and do your thoracic excursion. So take a deep breath for me. And slightly bend over a little bit. So his spine is aligned. So there's no scoliosis or kyphosis or lordosis seen. Lift your arm for me real quick. Inside. So now I'm going to listen to your heart sounds. So I'm going to do start with your aortic valve, which is the right second intercostal space, right sternal border. Okay. And then the pulmonic valve is the left sternal border, second intercostal space. Third intercostal space, left sternal border is pulmonic valve. Or I'm sorry, that's Erb's point. It's the third intercostal space, left sternal border. And then fourth intercostal space, left sternal border is the tricuspid valve. And then the fifth intercostal space, mid-clavicular mitral valve. Okay. So I'm going to go ahead and I'm going to have you lay down, just watch your head. Okay, so I'm going to go ahead and I'm going to listen to your belly sounds. When was your last bowel movement?
This morning,
And last urination?
about an hour ago.
Okay. Do you have any tenderness or anything? Any GI issues?
No.
No? Okay. So I don't see any palpable masses, so I'm going to go ahead and just take a listen with my bell, with my stethoscope. So this is the right upper quadrant. Left upper quadrant. Left lower quadrant. And right lower quadrant. Okay. Valve sounds are present. About every 5 seconds, give or take, a little bit more. And I'm going to do some light palpitation. If you have any discomfort in here, just let me know. Right upper quadrant. Left upper quadrant. Left lower quadrant. Right lower quadrant. And I'm going to do a little deeper. Right upper quadrant. Left upper quadrant. Left lower quadrant and right lower quadrant. All right. So we are all done. Here's your buzzer. If you need anything, you can just hit this button and somebody will come. Other than that, it's good to meet you and thank you. Have a good day.